Good morning. How many of you come from multi-service, family service background? How many of your organizations? Okay. I think my journey this morning is probably going to be closely aligned with those of you who do many things for many people over many years. My name is Leslie Newman. I serve as CEO of Children and Families First. I've been in that position for 7 years. I've been with my organization for 22. Like the other two on the panel this morning, we all share one thing, and that's a background in education rather than in social work. So you can put that into context. Like Bill's organization, we're old. We're 130 years. And we are actually a merger of 5 organizations, which for a state like Delaware, we have a population of about 1 million people. We have 3 counties, and everything in our state is a state system. So for a state like Delaware, I'm very big. Be impressed. I'm going to take you through a journey, and just for a context, it was tied with growth. In the last 7 years, we've doubled the size of our agency. And we've done it by changing who we are and how we're positioned. About 11 years ago, Susan, I believe, the Alliance began their, it used to be Executive Management Program, now known as ELI. And in one of our first presentations, one of the instructors talked about the natural evolution of organizations. And I don't care whether you look at Peter Drucker or anybody, there's a natural flow. And some organizations are startups. They have that founder mentality, one person drives, and frequently they're single-focused, and then they develop and diversify over time. The second level is the service provider, and I think that that's true of many organizations in the Alliance Network. They see themselves as a quality provider of services in their community. I think what we heard Susan talk about this morning is that push to move us from that level 2 or phase 2 to phase 3, which is the transformational. And here, you are an advocate for social change in your community. You're not just about a transactional arrangement with whether it's government or foundation or corporation, but it is actually changing the way business is done, changing the way we interact with families and children. I'm switching around. We actually began, and I'd like to say it was with thought and purpose, but to be truthful, I think it was probably more happenstance. We were looking to shift our programs to things that got it right from the beginning. We were a traditional mix of child welfare, family service, and a few other things thrown in the middle. And we were looking at the impact of what happens to families when you don't do it right in the beginning. And we got involved first with the Nurse Family Partnership Program, which, as many of you know, is the gold standard with evidence-based work. But one of the things that differentiates the Nurse Family Partnership is that it has that focus on that early childhood piece, but it also focuses on the parent. And it looks at long-term employment, it looks at changes in abuse and neglect, it looks at changes in criminal justice behavior, and I like to explain it to our funders. It improves everything good, and it makes everything that's bad get less. And that work actually moved us to get involved with Healthy Family America, which didn't have the restriction of only working with first-time moms. We also have done Strengthening Families, and it's an evidence-based model that looked at family skill building rather than just single parent or parent-child interactions, and we do it as a group. We started off doing it with school-age kids, moved on to teens, And I'm actually pleased to say that we helped the program developer, Carol Comfer, to make a model that focused on the birth to 3 population. And we were fortunate enough to be able to recently receive a grant from the ACF that is, I hope, will help us inform practice, because what it's doing is focusing on the substance abusing population and saying, okay, if we do strengthening families for 14 weeks, focusing on those with birth to 3 children, what happens if we add 6 months of another evidence-based home visiting program partnered with it? Will it change the face of prevention of placement or increasing the speed of reunification? And so we've partnered with our local parents as teachers, and we will come back to you and let you know how it informs practice. The other thing that we did was get involved in community schools. Again, it was a happenstance. And for those of you who are not familiar with the community school model, you marry a social service and an educational system. And the way we've done it is to look at partnerships. Now, when we see the schools as being responsible for academic work, and that our job is to enhance learning and to build supports, ideas to have kids be successful. But one of our learnings in this process was, if we just focus on the kids, we're not going to be able to have true change. So we have opened up, in partnership with a federally qualified health site, a center. It's actually in the school district office. We have brought in degree and certificate programs for families. We've partnered with housing. We actually have developed a steering committee that includes representatives from corporations, the United Way, Department of Education, again, looking for a very holistic way of approaching. So this is how we started. We happenstanced into programs. Well, what that meant is that we needed to change our agency culture. We needed to look at how our staff were involved. And I'm going to share a resource for all of you. The National Association of State Mental Health Program Directors, through SAMHSA, will provide free, and I emphasize that word, free training for your staff. And what we did is we brought everybody in. Didn't matter whether you were a custodian, front desk staff, or program staff. Our theory was, if people didn't understand that we were not looking at what was wrong with somebody, but rather what happened to them, we were not going to be able to affect change on any level. And we're working in different systems, as you heard from our basic programming. So my community school people were saying, gee, if I could only get the teachers to understand what a difference it makes. We also made sure to include a survey of our staff, because it's very important, as you all know, and Bill mentioned it in the article in Family Society, that our staff feel their traumas when they work with people who have been traumatized. So staff need to understand what are the triggers in the kids, but they also need to understand what are the triggers in themselves. And that was really a very important thing for us. We have a very small residential program. I've had it for years. We have 10 children who are residential and 8 who are day treatment. But we have made sure that all of our therapists are trained in trauma-informed care. Yes, all of the children who come to us come with a mental health diagnosis, but what unifies them is not the type of mental health diagnosis, but they've all sustained trauma over a period of time. We've also been working on training our staff in child development and the impact of trauma. And I think one of the things that I've read that I think is very important, and I think many of you may share this, what kind of staff do we want? We want staff that's supportive and caring. We want staff that's respectful. We want staff that's understands strength-based, that's collaborative, not controlling, but collaborative. We want staff that's empowering. Carlene mentioned her empowerment. We want staff that know how to give choices. And we also want staff that are all about self-esteem building. All right, so we've changed, or we're in the process of changing our culture. It's more than just our programs. It's more than just our staff. It has to be changing who we are and how we see ourselves. And I'm very proud to tell you that our board and our management team got together recently. And as a result of the learnings and the experiences and the journey that we've been on these last 5-7 years, we've actually changed our strategic focus. So now we see ourselves as helping children facing adversity on their journey to adulthood. We use proven methods, and that's meant to refer to evidence-based, evidence-informed practice, to help families. So our focus is no longer just on individuals, adults, but only those adults who are involved with raising or working with families. And our goal is to help those children flourish. Now, our journey is fine up until this point. We have our staff, we've changed our programs, our board has embraced the concept. However, we would not be getting to that transformational level. We would just be a service provider at this point if we hadn't moved further forward. So we are working at changing our community's culture. I mentioned we have a federally qualified health center now. We did it in partnership. We didn't suddenly become a federally qualified health site. I'll give kudos to the summit that I attended with Susan, and I had the opportunity to hear the folks from Drexel University, the 11th Street Clinic in Philadelphia, who have married ACE's work, the One Science work, with a federally qualified health site. So in addition to having the traditional medical, dental, mental health services, they have a whole array of mindfulness, yoga, and things that will have been seen to actually positively make changes in many of these families who have high ACE scores. So what can one little person do? Well, I'm taking a field trip. I'm bringing funders, I'm bringing my federally qualified health site partner, and I'm bringing a new partner that I've developed with the head of the adult division of substance abuse and mental health in our state. And we are all going to see the 11th Street clinic because my goal is to replicate it in our health site. Well, what else can one little person do? Well, this little person, I've been involved in many planning processes, and I'm happy to report that our state has, our Division of Public Health has developed a planning process, and that planning process identified goals for their mapping process. Well, they emphasize the improvement of access to mental health and behavioral health substance abuse services. That's for adults. At the same time, and if any of you are not involved with your public health systems, I encourage you to be, because there were ECCS grants going to public health, and they were all about toxic stress. So our state, in partnership with all of us who are sitting around the table, has developed a emphasis on education about toxic stress, focusing on the mental health of the early childhood population. So here we have this marriage of two things within public health, and there are enough of us who move from table to table that we're able to carry it through. The other positive thing that's happened, we're a little behind the rest of the country in terms of actually gathering ACE data on a statewide basis. Washington has done a great job. There are other states around the country who have done it as well. As a result of my sitting at the table with these different partners and our connections with Rob Andon now, who is my new pen pal, it looks like we're going to actually have the resource in our state to change the BRFIS, am I saying it right? inventories that will go out and add questions so that we as a state will be able to learn about our ACEs. Again, it's all because we have people who are talking to each other and becoming increasingly aware. And one last thing is that we have a project that focuses on teens in our state, and it's called I Am 40. It's based on the Search Institute's work. And the idea in the Search Institute is to build on assets, and that kids have internal assets and external assets. And when I was trained in it, what I learned is that it's much easier to be respectful of a child who comes to us with high external assets. They have loving homes, they have a supportive community, supportive faith-based, supportive school, whatever it be. However, those kids who succeed and do well, who come with high internal assets, those are the kids we really have to look twice at. So what we are part of is a statewide effort to change the way we as adults talk with kids and support kids. So we are actually looking to determine what are the assets that they have and what are the assets that they'd like to build. And we do it in partnership, not only with the youth, but we do it in partnership with our with the community members, the teachers who teach them, again, trying to change that culture. So here we are, this little state, who I believe is doing really big things now, and we're involved in conversations. One of my takeaways from the summit was hearing the vast array of medical providers who were talking about changes across this country. And one of the things that was said was that kids are worse than they used to be. And one of my learnings was that kids probably are worse than they used to be. Because from what we understand now, imagine a child who's born to a parent who has a very high ACEs score. And they have had their brain development changed by the impact of all of those adverse events. So that their brain now doesn't look like a brain of someone who's not had trauma. Imagine they have a child. You have that nature of that brain being married into an environment that probably has not changed much from when they were children. So we have nature and nurture colliding in the worst possible way. Much like if you look at our table, Leslie, you can hold it up, our little thing fell down. Because we had too much, I think we had nature and nurture, and we had too many heavy weights. So I encourage all of you to experiment, to work in partnership with the people in your community, to share your learnings and be open to learn. Because you may not start off saying, gee, I'm going to address toxic stress in my community, and I'm going to make a difference. But if you keep your ears open, and your mind open, I think you'll be able to set off on a path that'll make a difference for you, your clients, and your community.